Hello, everyone. Welcome to the webinar. We are going to wait one more minute or maybe about 30 seconds right now to give everyone a moment to log in and join us. Great. So it's looking like it's about noon. This is the Ayurvedic Herbs for Immune Health webinar. And my name is Dr. Juliet Sweet, and I'm a naturopathic doctor and also an Ayurvedic practitioner. And I'm also very excited to have the CEO of Rebel Herbs here, Jason Edwards. You want to say hi, Jason?
Hello, everyone.
So we're gonna get started. I usually just like to make sure that people can hear us and see the webinar, see the PowerPoint that's being presented. So if you could just type in the question box, yes, I can hear you, yes, I can see the webinar, or the PowerPoint, it would be great. I just want to make sure we're locked and loaded before we start. It says, let's see, all good. Yes, I can hear you. Wonderful. Okay, so it's a very challenging time right now. So we wanted to kind of just offer some insight on immune health and what you might be able to do to feel good about prevention, and also just educate a little bit about Ayurvedic philosophy and how we look at herbs and different treatments when it comes to stimulating the immune system, modulating the immune system, and really to be able to increase a person's vitality so they can handle whatever comes their way. This is a little bit about Rebel Herbs. So the brand was born in 2015. And then the founders are Jason Edwards, who's joining us today, and Girish Soman. So our headquarters are in southern Indiana, but there's also 3 certified organic farms in India. And the mission is really to simplify Ayurveda. So to create a marketing vehicle that compensates everyone in the supply chain fairly. And this company is very passionate about farming and organic farming, herbal extraction, and creating a fair and sustainable supply chain for everyone involved. So this is a little bit about immune health and really looking at immune health from an Ayurvedic philosophy. So Ayurveda says we are the microcosm of the macrocosm, and just as there's elements in nature, those same elements are inside of us. And so we look at this concept of the elements and how they might play a role in our health. And I recently listened to a webcast from Dr. Catherine Clinton. She's a naturopathic doctor, and very much about the terrain of the person, the terrain of your body, your immune system, just your whole being, and really how that's an important precursor to being able to ward off infection, your mental and emotional health, and how it all plays into immune system and sleep and just the foundational pieces of our health. And so I thought that was really amazing because she talks about the different elements in nature and also the science behind each one and how that it's really is important for our immune health. So ether is basically space, and this is space inside of our bodies. You can think about the space inside of the lungs. But also I am thinking about this space that's been created in the world right now, and what are you doing with it? Are you choosing to um, meditate and look at the deeper levels of spirituality and eat good food and do stress reduction, or are you really stressed out? And the space that's been created, is it shrinking because of all of the fear? We have air, which is prana, and that's our life force. It's directly related to lung health and oxygen getting to every cell of our body. Fire is metabolism in the body, but we also look at that as the sun, and we know the importance of vitamin D in immune health. And then Dr. Clinton mentioned how when you have a fire, actually the light that's being produced by that fire is considered a red light. And there's a lot of science around the positive effects of stress reduction and immune health using red light. So I thought that was really interesting. And of course, water is the majority of our makeup, and it's foundational to health. And then earth, we know spending time in nature decreases stress, It improves the immune function. And then we're here today to talk about the wisdom of the plants and really the medicine that's just surrounding us, and how these plants know how to help us. And so, of course, this webinar is for educational purposes only, and we're here to just talk about things and discuss the research that's coming out, and also we don't claim any of our products prevent, diagnose, or treat COVID-19. So the power of Ayurvedic herbs, these are some pictures from the farms in India. All of the formulas are considered rasayanas, or rejuvenative tonics. And the great thing is they're suitable for all constitutions. So they are helpful for everyone, no matter what the constitutional makeup is or the doshic makeup. They've been formulated by Dr. Fadki, who's been formulating for 40 years in Ayurvedic medicine. He's a third generation Ayurvedic practitioner. Also, of course, there's 5,000 years of empirical data to support the formulations, but there's also this modern science that's coming out as well. So we'll take a look at that. And then Jason's here to talk to you today towards the end of the webinar about the different extraction methods and how important that is for the products Rebel Herbs has to offer. This is the first herb I want to talk about. This is called Amla, and it's actually a fruit. So there's 3 different trees and 3 different fruits that make up a really famous Ayurvedic formula called Triphala. So Triphala is 3 fruits, Triphala. Amalaki, Bibataki, and Harataki, but we're talking about Amalaki today. And the reason is this little sour and super fruit is full, just packed full of vitamin C. So as you can see, it's 60 times more vitamin C than oranges. The ORAC value is 261.5, where the super berry acai, which is very well known as a superfood, is 102.7. And goji berries, which I love, they are 3.3. So you can see the difference in how potent these little guys are. And all the different actions that they have on the body. And they are very helpful for supporting immune function and very safe as a fruit. They do help with blood sugar regulation. So be careful if you have a patient that's on type 2 diabetes medications, because it can cause hypoglycemia. So we're going to talk a little bit about some research on the immunomodulating properties of Amla on our lymphocytes. And the aim of the study was really to determine the antioxidant and immunomodulatory properties of Amla. And what they did was they used chromium to produce immunosuppression. And so with the chromium with a toxic load, it increased cytotoxicity, free radical production, lipid peroxidation, and decreased glutathione peroxidase. It also diminished glutathione levels. So there was a significant inhibition of lymphocyte proliferation, and it also inhibited interleukin-2 and gamma interferon production. So there was also enhanced apoptosis of DNA fragmentation in the presence of chromium. So it was enough to be affecting the cells and the DNA and creating cell death. So what Amla did was it actually significantly inhibited chromium-induced free radical production. It restored the antioxidant status back to control levels. So kind of finding that that happy place of homeostasis for the cells with those levels. And it also inhibited apoptosis and DNA fragmentation that was induced by chromium. It relieved the immunosuppressive effects of chromium on lymphocyte proliferation and also restored the IL-2 and gamma interferon production considerably. So really helping to sort of mitigate damage that's been created, and also anytime there's immunosuppression. So whether it's stress in the body and just the natural effects of stress decreasing our immune system, or maybe there's, you have a patient who has a pre-existing, they're immunocompromised. So it can be very helpful for that. And so Rebel Herbs has two different forms of amla. We have a dual extracted powder, which you can just add right into water. You can make a tea, you can add it into a smoothie. It's very easy and very potent, and we'll talk a bit about the potency later. But if it is kind of sour and astringent, and so if patients prefer, we also have capsules for that as well. So neem, this is our super, let's see, I had some notes saying that people were unable to hear me and that the volume was gone. Is that still happening, or can you hear me now? Jason, are you able to hear me?
Yeah, I can hear you.
Okay, good. Now people are saying they can hear me. I'm sorry if it cut out a second ago. I always like to check that because I've gone through webinars and had issues. So, okay, we have Neem next. Technology. So it's considered India's pharmacy and toothbrush. Basically, you can use the sticks as a toothbrush. It's very anti-everything, anti-parasitic, antibacterial, antifungal, antiviral. It's an antioxidant, anti-inflammatory. You guys can read the list. It's anti-malarial. Very, very, very potent. And when this whole pandemic started, before it was even considered a pandemic, I was actually at dinner with Dr. Drew and Dr. Dean, who are very well known in the Ayurvedic community and are part of the Ayurvedic Association on the national one. And so I asked, what are you thinking about when it comes to prevention? And neem was the first thing out of their mouths. So it really is and does have a reputation of just being sort of nature's antibiotic, nature's antiviral, that sort of thing. And so you can see all the different actions and constituents that we have here. Be careful if your patients are wanting to get pregnant, and it is also helpful for type 2 diabetes, so watch for hypoglycemic effects. So neem capsules we offer just as a single herb. We don't have a powder because honestly, most things that are super antimicrobial are bitter and really hard to get down, so you don't want to taste them. So this was just a viral studies search. There's so much on neem. There was studies on HSV, so herpes simplex 1 and 2, EBV, cytomegalovirus, varicella, dengue, Japanese encephalitis, HIV, foot and mouth disease, inactivation of human type A and B influenza. So very, very powerful and potent antiviral and antimicrobial in general. I really want to talk about our sort of star product, which is Immunade. And as you can see here on the far right, these are the ingredients. So we have our Amla in there. So we're going to get that, the vitamin C, the antioxidant properties from Amla. And then we have neem in there as well. And Jason will talk a bit more about the extractions and why these things are listed twice and what the different types of extraction are. But then we also have some other herbs. We have Tinospora cordifolia, which we'll talk about, turmeric, ashwagandha, ginger, and it's really sort of a powerhouse formula for the immune system. So Tinospora cordifolia is known as Guduchi, and it's also known as heart-leaved moonseed. There's lots of different constituents. What I love about this plant is it's really safe. I couldn't find anything where it was contraindicated. Of course, there's not a lot of research in pregnancy or lactation. So very, very well known as an antiviral, antibacterial, an adaptogen, anti-inflammatory. Once again, all of those anti. And so it's a beautiful, beautiful heart-shaped leaf, and it is just sort of, we'll talk more about the theories on its use in the current pandemic. So we have an article specifically here on coronavirus, COVID-19. this was really looking at a lot of different discussions on, the virus and vaccines and just everything to do with it. But there was a small little part about some herbs, and the herbs that were mentioned were Guduchi and Neem. And it talked about how the Neem was the type that they used was used with HIV therapy, and the Guduchi that was used was successful in treating dengue fever. So the herbs really help patients improve their immune profile and balance physiology. And the third herb they mentioned was hing, which is asafoetida. And you might know about that one from using it in cooking. It helps, if you don't know, you should experiment using it with beans because it will help absorb the sulfur and decrease gas. So just a fun little fact in the middle of our immune webinar. So it said that the neem, the hing, and Guduchi were used on the front line to mitigate the novel viral infection and actually helped a number of patients in safe recovery from the disease process of COVID-19. So it's always fun to see what new stuff's coming out because it changes every single day. So turmeric, you guys are probably really familiar about turmeric. And there's so much research out there. So in general, it helps to modulate. I would consider it more of an adaptogen. It can help stimulate, but also decrease if there's excess inflammation, and really just helps modulate the immune system. And so here's a little bit about the different pathways. We have, and all of my resources, you can look at these studies, they're at the end, but there was a study on curcumin and echinacea, and really the effects of decreasing inflammation. So the immunomodulatory abilities of curcumin, it's really helping on a cellular level with dendritic cells, macrophages, B and T lymphocytes, but also molecular components involved in the inflammatory process. So these are our cytokines, and you've heard a lot about cytokine storms being an issue with COVID-19, but it's also helping on a DNA level. You can see in that first diagram here, it's affecting the transcription of these interleukins and cytokines, and inflammation in general. And then you have your early and severe stages of COVID-19 and what's happening. It's not complete, so the only interleukin they mentioned there is 6. But there's basically 2 phases, right? So we have our immune response phase, which really is sort of the initial phase where generally just good health and a strong, robust immune system is crucial, so that you aren't progressing to the severe stage. When you get to the severe stage, that's when we're looking at more immunosuppressive or immunomodulating to decrease those cytokines that are creating havoc, not only on the lungs, but the GI, the kidneys. And so that immune modulation is really important. So this article said blocking IL-1 and TNF may also benefit patients, and really turmeric will help with IL-1 and TNF because it downregulates them, and it does that through the DNA. So then we have on the far right curcumin with cerebral malaria. And why I was looking at this was just what's happening when there is sort of a similar response in the body. Because with cerebral malaria, you often have this sort of overreaction. Of course, there's, for good reason, because it's inflammation in the brain and everything like that. But it can also lead to issues with breathing and can kind of be compared in that way. And so it's really looking at how is it decreasing inflammation. Once again, they're looking at NF-kappa B and downregulating the pro-inflammatory cytokines and the adhesion molecules, which is also a piece to note. And they're all implicated in the pathology of cerebral malaria and also being seen in the COVID-19. So we have ginger next, and ginger is really well known. It's been used for thousands of years, both in traditional Chinese medicine as well as Ayurvedic medicine and Western medicine too. It's or Western herbalism. So there's lots of different studies on ginger, but it's anti-inflammatory, antiviral, antioxidant, and can really help with some of the GI stuff as well. When I did a search for viral and ginger. I came up with some stuff on hepatitis B, HIV, HSV, norovirus, and HRSV. So just thinking of the different components. And it's also what we call a synergizer and a driver. So it helps the other herbs and formulas get to where they need to go and increases circulation. And it just really is very helpful for synergizing in the body. Ashwagandha, this is also known as winter cherry. And this herb I love for decreasing stress. So what ashwagandha does is it helps your vitality and your immune function work its best by decreasing cortisol, our stress hormone. So it's an adaptogenic, it's a rasayana. There's lots of research out there showing how it helps with decreasing cortisol and anxiety. And when I think about all of the emotions going on in the world right now, I would definitely be thinking about ashwagandha. And it's in our immune formula for that reason. So holy basil is what I want to talk about next. We have holy basil as a dual extracted powder or the powder in capsules. And we just did an hour-long CE webinar last month on holy basil. You can visit our website, rebelherbs.com. And if you are a naturopathic doctor or Ayurvedic practitioner, you can get CEs, but you can learn all about holy basil. And it's with Dr. Healy from Hawaii, and just all the different things it's being used for. It's so amazing. It's really the holy grail. So I do want to talk a little bit about some studies on Tulsi and the viruses that have been, well, we'll talk about COVID-19, but the viruses that have wreaked havoc in the past. And H9N2, they were looking at, holy basil leaves and how effective it was, being not only decreasing viral load, but the time that was needed to use the holy basil, and then prophylactic, so using it prior to having this virus sort of inoculated into, and they were using a chicken egg model in that one. But what they found was really that it was significant in decreasing viral load. It was prophylactic, and it showed the most significancy with being antiviral with a crude extract and a terpenoid extract. And that was compared to a polyphenol extract. But really just showing how, we can look at this as a preventive as well as a treatment once a virus does infiltrate. But how do we stop it from replicating? And then H1N1 was also looked at, and they actually compared holy basil or Tulsi to oseltamivir and zanamivir, so very known antiviral drugs for the swine flu, and they observed the side effects. What they found was actually that Tulsi was more effective, and it was the constituent abigenin, and it's an active constituent in Tulsi, but it was more effective as far as they looked at absorption, distribution, metabolism, excretion, and toxicity. And so they really, it was stronger when it came to binding and having the sort of preventative and also very low toxicity compared to these antiviral drugs, which I thought was really interesting. And I want to make sure I have time to give Jason. So I'm going to cruise through here. This is the role of holy basil in the current pandemic. So really it's being used in the management of pain, diarrhea, cough, and fever, which are common symptoms of COVID-19. They're also using it with cow ghee, and it's the best medicine for pneumonia. It's been proven to be effective in inhibiting several deadly viruses: Newcastle disease virus, vaccinia virus, infectious bursal disease, also in hepatitis, encephalitis, used with respiratory issues, and also helping to restore physiologic functions and psychological functions after the pandemic or the virus is affecting people. Here was a little bit of an expert opinion on prevention and treatment, and they interviewed 110 Ayurvedic practitioners all over India. And it's really great because they have some charts in here. I recommend you actually look this up and just kind of read it over. It's pretty new. It just, is coming out, and we have to take a look at what's going on in traditional Chinese medicine and Ayurvedic medicine, and how can we integrate these things in the United States. But over and over again, with all the different charts for all the different phases, Amla is mentioned, Guduchi is mentioned, and um, it's really an ashwagandha as well, and also pranayama, which is breathing techniques. So mucous membrane, Mojo, we have our nasal passages, our mouth, our throat, our lungs, and these are some ideas that you can do to keep the mucous membranes healthy and decrease the ability for anything to infiltrate your system. So those are my resources, and I want to introduce Jason Edwards. I didn't give him very much time. We will stay afterwards to answer questions, but I will go ahead and turn it over to him so he can tell you a little bit about the company and the different extraction processes that we have.
Thanks, Doc. Hi, everybody. This is Jason Edwards. I'm the CEO of Rebel Herbs and one of the co-founders. What Dr. Sweet has been talking about today has been the herbs themselves. What I just want to kind of highlight some of the company features that makes our extracts slightly different, actually quite different than what you'll find in other types of extractions. We do tout that we have 3 unique delivery systems: our dual extracted powders, which are also used in capsules, but we have them in a single herb powder that allows you to make it a part of the patient's lifestyle, put it into foods and beverages. Our formulas are all simplified. Dr. Sweet mentioned this earlier, that there's no requirement to understand Ayurveda. You simply have to read the title on the herb and utilize it appropriately. And then our vapors. Our vapors are also known as Dhumpan. Dhumpan is medicinal smoking. It skips first past digestion, gets into the bloodstream, goes to work immediately. Gives you a method to administer these herbal medications through the lungs, which is a common route to send medicine. We're very unique in that area, and our vapors have no synthetics in them, no propylene glycol, no vegetable glycerin, no vitamin E acetate, no cannabis, no nicotine. The list of no's gets longer and longer as we go through this, but essentially the inhalation route allows us to skip that digestion. It's only for practitioners, so we sell through practitioners like yourself. Our market is naturopaths, chiropractors, DOs, MDs, quite a few. But I want to take a minute to talk about our extraction technology. The powders that we use in capsule and in the single herb powders is quite unique, and I can go over this very briefly, but I want to show you a couple of differences in the types of extraction. Dual extraction means that we do 2 extracts on the same material. We pull out the hydrophilic compounds, that is the water-soluble or alcohol-soluble compounds, and we also do a lipid extraction using a process called CO2. Carbon dioxide under high pressure has been used for decades to withdraw the lipids from a plant. So between these lipophilic compounds and the hydrophilic compounds, we now have a complete profile of the herb. It gives us an extraction that is a truly full spectrum. We're replicating what Ayurvedic practitioners did thousands of years ago, just using the technology of the day. For example, if you had a milk extraction of turmeric, we call that golden milk. Milk has water in it, and it has fat in it, and fat pulls out fat, and water pulls out water. So between those 2 compounds and the minerals that are found in milk, it's an excellent extraction agent to pull out all of the therapeutic compounds from the turmeric. Now, what you see on front of you is a comparison of a dual extract, we call it in this chart a holistic extract, and a water extraction. This is of holy basil. And you'll notice the peaks. The lighter pink on top has much higher peaks in most cases. And the blue line on the bottom shows you other peaks that aren't present in the dual extract, or that are much, muted. So you can see there's a huge difference in the one-sided, water extraction and a dual extract or holistic extract. Let's see the next slide there. These are all HPLCs of the different products. This is ginger. So typically ginger is a water extraction. That's an excellent way to extract it, but look how much higher the peaks are when we do both a lipid extraction and a water extraction. Combine them together and create that powder. Huge difference. This means that you can lower, next slide please, that you can lower the dose and increase the benefit. This is turmeric. Turmeric has just a few curcuminoids in it. There's actually 5 curcuminoids that we measure, and you can see these 3 very large peaks in our turmeric extract. But turmeric is what I really want to talk the most about, and when we get through these slides, I'll talk a little bit more. There we go. So one of the downloads or the handouts that's available on this particular webinar is this slide right here. You can see this is a turmeric extract in comparison, a comparative study. The blue line represents our dual extracted turmeric powder. The red line is a 95% curcuminoid preparation. This is a in serum comparison, blood draw every 10 minutes. And what we found was, as you can see, the blue line, the dual extracted turmeric, had 3 times the level of curcuminoids appearing in blood, in the serum, as opposed to 95% curcuminoids, which didn't peak until about 60 minutes. But that peak on the dual extract was at 20 minutes. Now see how quickly that blue line falls out of serum. So down at the 60-minute moment when the isolate was peaking in the bloodstream, it's almost completely out of the bloodstream, suggesting to the researchers that this was getting absorbed faster, 200% faster compared to the 95% curcuminoid isolate. You also have better retention. It hangs out when the 95% curcuminoid extract hangs out in the bloodstream for too long, it's not being absorbed, it's being filtered out. And so getting it in the bloodstream and out is one of the big benefits. For me, this is a great chart as a salesperson, but as a purist, I look at this and go, this is not even telling all the story, because the lipid portion of the turmeric, which comes out in that CO2 extract, is called turmerones. And turmerones are likely the unsung hero of the turmeric plant. Very few companies are talking about turmerones. We've been talking about it for about 10 years. Before Rebel Herbs was even born, we were talking about turmerones because we knew that the lipid part of the turmeric plant offers just as much antioxidant activity as the curcuminoids do. It's much more bioavailable because it's in a lipid format. It improves the bioavailability of curcuminoids whenever it is presented together. It has a DNA affinity for the curcuminoids because they both come from the same plant. Turmeric is not curcumin, and curcumin is not turmeric. Turmeric is a combination of 179 different chemical constituents. And what we try and do with this dual extracted process is to bring out all of those beneficial compounds in the appropriate ratios that mirror that of the plant, and give it to you in a concentrated form so you can use less material, get more benefit, and have less issues with your patients. And that, I think, is my whole spiel.
So, and a half an hour flies by. I'm used to doing an hour-long CE webinar every month. And so thank you all for being here today and for joining us to talk about immune function, prevention, immune modulation, and really the difference in what you can see in Rebel Herbs products as far as the extraction methods, the potency. What I love in my practice is patient compliance, because you need just 1 or 2 capsules to have a therapeutic dose, or a quarter teaspoon twice a day, of our powders. And for patients, that are, especially ones that are taking a lot of different things, it's great when it comes to that, you know, that compliance, and just not overloading the system, and letting the powders be part of food and lifestyle. Really is kind of the idea behind rasayanas, or Ayurvedic formulas that Rebel Herbs has. So we are about 5 minutes over, but we will be here to answer any questions. If anybody has any questions for either myself or Jason, and I do promise to everybody who attended today, I will send you the PowerPoint so that you can have the research articles and resources, and kind of go over the things that I had to rush through at the end. So if there's any questions, just feel free to type it into our chat box, and we'd be more than happy to answer that. So will you also send a list of products and when you do webinars? We can absolutely do that. And rebelherbs.com, it's www.rebelherbs.com, has a lot of information on it as far as the different products that are available, both for practitioners. We also have a retail store, but there is a monthly webinar, and I can send that information out to you as well. Dose for Immunade, both maintenance and therapeutic. I would say 1 capsule twice a day for maintenance, but I want to get Jason's input on if there's more of an acute thing happening, and how he might recommend it be used to kind of amp things up
Well,
if needed.
yeah. Yeah, Dr. Fodke has told us. Dr. Fodke is our formulator in India. He's a third-generation Ayurvedic practitioner. He recommends for acute issues and issues that require some buildup, that you take 2 capsules with each meal. So it's a total of 6 capsules a day. And then after the initial dose loading on that, you can scale back to that 1 capsule twice a day.
Perfect. And let's see, we have some thank yous, and very useful as well. Always, you guys are so supportive. Thank you. Can we get a copy of the recording? Absolutely. What was the name of the herb used in cooking to avoid bloating and gas? Yeah, so that's asafoetida, or they call it hing, Hing, and it's a pretty amazing miracle when it comes to beans and cruciferous vegetables. So definitely
You can
experiment
get
with
that
that.
at just about any Indian grocery in the country, I think.
Exactly. And then we have, is Immuname better taken with or without food? I personally would recommend with food, just for not having any GI upset, or maybe after your meal. Jason, do you have input on that?
What was the question again?
Having Immunade with or without food.
Dr. Fodke always says to take these formulations with food, and drink a full glass of water with them. Personally, though, I'm an American, and I slug back a cup of coffee in the morning, and I throw my pills in and take them without any food. It doesn't seem to cause any digestive upset for me. No irritation or repeating. Some people it would, but the general recommendation is with food. But just know that there are people in the world that take them without food and don't have a problem.
And I like to think about the Ayurvedic philosophy too, of how food becomes all of our tissues. And so in some ways, you're putting in this sort of food as medicine, and it becomes your cells and your tissues. And so having it before or after, sometimes they recommend in the middle of a meal or before or after. We have another question that is, how do you recommend you take the powders? So I love using the powders with basically, after you cook your food, you can add the powders into food. Like the Amla powder, I would say is great in a smoothie. You could even add it into yogurt. But you can also just put it right into water. So before this webinar, I put a 1/4 teaspoon of the Rebel Herbs ginger powder in a little mason jar with just some plain water, shook it up, and I'm drinking it just as sort of an infusion. It's really a fine powder, even though it has both those lipophilic and hydrophilic compounds. It really does sort of immerse it, or disperse itself into water. You can make tea. You just don't want to cook your food with it because you don't want it to get up to a really high temperature and break down the medicine. Any other techniques, Jason, that you
Well,
like to use?
well, we just real quick, we have recipes on our website under the blog section, and you can find a lot of different recipes, things that we tried here in the office. I'll tell you, every morning during this, I have to be honest, I'm terrible about taking my supplements. Very haphazard. I just grab whatever's in the office, and I'm on travel a lot. But this quarantine's really forced me to refine my regimens. And so every morning I've been getting up, creating some coffee, and putting a 1/8 teaspoon of ashwagandha and an 1/8 teaspoon of saffron muesli into my coffee, and it's worked out really well. The flavors of those are kind of earthy, and it goes with the coffee. It's kind of like chicory added to coffee. And then hot tea, a lot of times with things like boswellia, which is going to help with musculoskeletal pain. You put a little boswellia powder in your tea, and it has kind of a lemony aroma to it. It's a very nice flavor addition, and goes to work real quick.
So we had a comment, ginger is used in cooking, so why would it matter heating your ginger powder? Do you want to answer that one, Jason?
Some of the compounds are very volatile, and so when you raise the temperature above a certain temperature, and it's different for all different compounds, but some of especially the volatile oils, will evaporate away. And so that's the reason that you'd want to not cook with them. When we cook with it, we get the flavors, and the more we cook it, the more we concentrate those flavors. But we do lose some of those volatile chemicals. And that's why sometimes you'll have recipes that'll say, cook this, and then at the end add this. And that's to, preserve those oils, which are going to evaporate off.
And I think too, when we're using like the whole plant in cooking, that has the plant starches and fibers, and maybe those, I'm just speculating, maybe those act a little bit as more of a protective thing, but our powders are really just the pure medicinal compounds, very potent. There's no ginger fiber or starch present, and so it's a very delicate sort of holistic whole spectrum plant medicine. And so that's kind of the way I think of using the powders, is just after you are cooking, they're really wonderful to add in afterwards. So
that's a good point, that the starch and the fiber does kind of protect those oils.
And so I'm not seeing any more questions. Any closing remarks, Jason? I'm just so excited that you were here today with me.
Well, I really enjoyed it. Thanks everybody for joining us and taking time out of your busy schedules. I know it's a weekend as well, which makes you doubly a hero. But if you would like to, I know our team has been very active in talking to you. P2 has been out there helping to get people to the webinar. And we're going to put out a sale for everybody that attended, and some free gifts as far as that goes. And we'll send that out to you in an email so that you'll have access to it. But thanks to everybody who made this happen. It was very quick. We threw it together in a couple weeks. And it's in addition to our normal webinars. So kudos and hats off to everybody who made it happen.
Thank you, everyone, and enjoy the rest of your weekend. And we look forward to continuing to chat and collaborate with you. So thank you.
Thanks. Take care.
Bye.